Good evening, everybody.
Good evening.
Thank you for coming out. My name is Julissa Jones. I am the president of Excel, the student organization whose mission is to raise public health awareness for marginalized communities and also bolster social media communications to expand the communications. And we are doing this by aligning our events with the awareness months. So for February, the Black History Month, and we had an event every week around different issues, healthcare issues within the Black community. And this week, we will be showcasing our excellent panel, who are Black professionals who work within the public health space, and they'll be sharing some of their experiences, navigating that journey and some of the racial tensions they had to navigate and how they did that. Our host for the evening will be Temi. She is a third-year doctoral student in the social and behavioral department here. And she will be introducing everybody and moderating the discussion. So thank you, and please enjoy and ask abundance of questions.
Thank you. Hi, everyone. So, can you hear me okay? Great. So thank you for joining us today on this panel. And like she said, we are celebrating excellence, and we know the story of excellence. Excellence is the outcome, but there's always a story behind it, and it will be wonderful to hear the different stories on this table today. So I am Temi. I'm a third-year doctoral student at the School of Global Public Health. I'm in the Social and Behavioral Sciences Department, and my research focus is implementation science within the space of cardiovascular disease prevention and management. So just to introduce our panelists to you today, we have towards the end of the table over there is Ms. Claudine Lavarin.
Okay.
And she graduated last year from the MPH program. Yes. And right now she is working as an associate research scientist at NYU Rory Meyers College of Nursing, Global Health. So a little round of applause. Next up is Dr. Emmanuel Peprah. He is currently the Director of Implementation Science for Global Health and an Assistant Professor of Global Health here at the School of Global Public Health. So please welcome. All right, next up is Dr. Melody Goodman. She is the Associate Dean for Research and Associate Professor of Biostatistics here at the School of Global Public Health. And last but not the least is Miss Ekemini Isaiah. She is a graduate of 2018 class, MPH, and now currently working as Consultant 1 at Avalere Health. Policy and management was the concentration she had here at the School of Global Public Health. So please welcome me. All right, so to delve into our discussion for tonight, we want to learn about your experiences as Black professionals, Black public health professionals and practitioners, and I'm sure in some spaces patients as well here in the United States. We want to learn about your experiences and understand how you have navigated this field for yourself and attained the success you have today. And so to start us off, I just want you to tell us a bit about yourself and how you came into the public health space. And we will start with Ms. Claudine.
Hi everybody, just a correction, so I did graduate from the policy and management concentration, and an update from when my bio was made. I'm actually the project coordinator at the position that I'm at now, so just wanted to let you guys know that. So as you know, my name is Claudine Lavarin, and I'm a recent MPH graduate. How I came into the public health space. My older sister has sickle cell, and before her, my parents had another daughter who had sickle cell, so I kind of grew up in the hospital space and just knew that I wanted to do something health-oriented. And then I went off to college and majored in bio, pre-med, and that was not the route for me. And one of my advisors told me about public health, fell in love with it, and then I've been public health straight through. And a recent update as well. Literally, as I got off the bus coming here, I just found out that I got accepted to Boston University's PhD public health program. So that's how I got into the public health space.
Mr. Peprah?
Sure. I am going to make my story very, very short, so because it can be a very long story. So after finishing my PhD, I did a postdoctoral fellowship at Emory within the first, the program is called Fellowships in Research and Science Teaching. After about a 4-year postdoctoral fellowship, I went to the NIH, and I was planning to be at the NIH for about maybe 2 years and go back into academia. Lo and behold, I started a lot of interesting projects at NIH, including helping launch H3 Africa, and then for the past about 4 or 5 years or so, I've launched the Center for Translation Research and Communication Science, or CITRIS at the NHLBI. So unfortunately, or I would say fortunately, my original plan to stay at the NIH was maybe 2 years, but after being there for almost a decade, my research expertise broadened, and I ended up in the public health space. And then after almost a decade, I felt that it was time for a change. I was adjunct professor at the University of Maryland Global Campus, which is a part of the University of Maryland system. And then I had an opportunity to really go full-time here. So it's sort of been a very interesting experience, not a non-linear experience. So hope to discuss that a little bit more later on as we continue.
So I found public health on Google. So after undergrad, I went to work as a financial analyst on Wall Street. And one day as I hated my job, I just started Googling to find out what I was really gonna do with my life, because that wasn't gonna be it. And I decided, so I went to Wall Street because I wanted to be rich, obviously. But when I was on Wall Street, I decided that being rich had more to do with it just making money. And so I was trying to figure out how I can do something fulfilling. So I Googled math and health, and that's how I found biostatistics. And I actually went to the Harvard School of Public Health to study biostatistics. I did not know what public health was. But when I got there, it was like a public health Christmas. Learned all these great things about public health, and I've been in the field ever since.
Hello everyone. So again, my name is Ekemini Isaiah. So I think, like many people, when I was growing up, I was really good at science. I knew I wanted to help people, so the obvious decision that my parents pushed down my throat was medical school. But then when I got to undergrad, I was a biology and society major. So I was studying a very fancy way of saying I studied biological sciences and bioethics. And I was exposed to the ethical dilemmas in our healthcare system, ethical dilemmas in access, quality, and cost of care. And that's really when the term public health really started circulating through the undergraduate community. I realized that I really wanted to do that. And then knowing me, constantly asking, why are we in this situation? Why are we in this scenario? When you keep asking the why question, you really look upstream and you realize that policy can impact a lot of the things that you're seeing in your own community. So I knew I really wanted to work in that space, and that's why I ended up being a health policy and management concentration here at NYU, and really looking from an international perspective, from a community perspective, across stakeholders, trying to figure out how we can kind of improve our healthcare system overall. So that's how I got here.
Thank you very much. And to follow up on that question, so as a Black professional in this space, how have you navigated your journey knowing that on this table there's been like a variety of origin stories, so to put it, from personal experiences or experiences within the family to having a career switch, and just also understanding for yourself organically what public health looks like to you and how you would like it to be. So could you tell us a little bit about how you have navigated this career path for yourself as a Black professional?
So I think I was battling two separate things. I was first battling my family in the sense that they didn't know what public health was. They didn't know what careers could come out of that. So with unknown comes concern. How are you going to make a life for yourself? What does this even entail? How will you be able to provide for yourself? So I had to have a certain level of patience with educating my family on what this area was and proving to them that I was confident that this is a space that I really wanted to work in. But I think the other side for me was figuring out myself what it would look like. I don't have many people around me that work in health policy, that work in Washington, D.C. So constantly having to surround myself with mentors and asking that question of, I'm really interested in this, can you tell me more, or what this looks like, or what does it look like from a career perspective? And having them connect me with people that they know, and kind of having a patchwork answer over time. So I really think being patient with myself, allowing myself to explore my interests, giving myself the opportunity to that, not just pushing it to the side and saying that medicine is the way I'm supposed to go, but also reaching out to my network and making sure that they support me in that way was how I've navigated this space.
So my first job was at a faculty member at a medical school, and while I thought being Black was going to be a challenge, or even being a woman was going to be a challenge, at 27 years old, being young was my actual challenge. And so now I've decided that I don't think of myself as a Black professional, I think of myself as a professional, because white people don't have to think of themselves as a white professional. And you never know what ism people are gonna have against you. And if you go in with preconceived notions about how people are gonna treat you, like I was shocked that they were like ageist. You never know how to respond. And my dean said, once you get some gray hair, people will treat you differently. Which I don't know if that's true or not, but I have lots of gray hair, so we'll see how that happens. But I think, as a young professional, you're gonna be battling against so many different isms, and you shouldn't put yourself in a box. You should approach the world how everyone else would approach the world. You're a public health professional. The nice thing about being a minority is I think you see the world a little bit differently. You already know that life was gonna be challenging, so I say to my students all the time, if my life was gonna be easy, I would have been born a white man. Not that I think all white men have easy lives, but definitely probably a little bit easier than a Black woman who was brought up low income. And so I think just don't put yourself in a box, because you never know how other people are gonna define you. And you never know what sort of isms you're gonna have to address. And so don't put the ones in front of you that other people may or may not put in front of you.
I really have to agree with that. I think that's actually tremendous advice. So for me, I think that in many ways, it has been, my ignorance has been very helpful in terms of just not knowing what isms other people has. And those are their issues. They're not your issues, so why do you have to deal with them? All you do is, again, going back to the word of a professional. 90% of the job is showing up every day, being professional, acting professional, and those things, the rewards of your profession will one day become apparent. So again, I think I see myself as a professional, and I really don't care what other people have to say, because at the end of the day, the question is, am I doing good science, is the science I'm doing impacting the people that I want to impact? And basically, that's it.
I definitely agree with what all the panelists said. I grew up in a PWI, so I was used to kind of just being the only Black student in spaces, and it didn't really bother me too much or affect me too much. So I think that kind of just started to make me feel uncomfortable. Started to make me feel comfortable even when I was the only Black person in the room, as I did grow within public health, one thing that helped me was building community and finding mentorship in these spaces. I've had the privilege of having really great mentors to help guide my journey, similar to what one of the other panelists said. I did have to make the choice of switching over from pre-med to public health, and similarly having to explain that to my parents and stuff, but having a strong mentor that was there to guide me through the process was definitely helpful. So I guess a piece of advice when navigating through a public health space, which is very broad, definitely find mentorship and building your community.
Thank you, Claudine. And you are leading us right into another question we have today, which is really helping us highlight who are the people in your life, fictional, nonfiction, dead, alive, who have influenced your path as professionals and practitioners in the public health space. So this could be a little personal, or it could also be about the mentors you sought out. How did you make those connections and build a network for yourself in the public health space? Anyone can go first.
So I'll go. I think it took me a long time to realize that the best mentors for me weren't going to come in the package that I thought they were going to come in. So I thought my mentors were going to be Black women. I'm a Black woman. But the best mentors I've had in my career have been white men. People who have really supported me and sponsored me and talked all about me when I'm not in the room. So one thing I would say is, you ever get a Christmas gift and it's just not wrapped right, and you feel like, why'd you give this to me? But it's the real gift that you want, right? Like my brother will often give me a gift in a shopping bag, but it's what I really want, right? And so sometimes just because things don't come in the package that you expected it to come in doesn't mean that it's not great. One of my career role models, and y'all are gonna laugh at me, is Beyonce. And for several reasons. So those of you who love Beyonce, I love her too. Please don't put memes all over my Twitter. But one of the things I think Beyonce has shown me is that you don't have to be the best to be number one. I don't think she's the best singer. I don't think she's the best dancer. But I do think she's one of the best entertainers because she works extremely hard at her craft. And so I really modeled myself after her. It's like I don't have to be the best to get to where I want to be. I just have to be confident and good and be willing to work really hard. And I think if you're willing to do those things, then you don't have to worry about sort of the environment that you're in or what other people are doing.
And any other stories to share about?
Sure. So, interesting, we have sort of parallel stories, just hearing your story. So most of my mentors, actually all of my great mentors have been women. So from my graduate school, which was a short Indian lady named Manu, brilliant, and she would, and Tammy knows this, she would look at my writing and just, at that time, she would use a red ink pen, and I get back a paper and it's just full of red. Just, that would kill me sometimes. But it would make me better, because when somebody takes time to edit your writing, that is definitely somebody that you can say is really mentoring you and showing you how to do this. If a person does not look at your writing and you give this to them and say, it's great, there's something. I would just say, just be careful of that. So her, Stephanie Sherman, and Emory, another short white lady, just was a great mentor during my postdoc. So in most of my career, like you said, mentors come in different packages. They're not going to be the packages that you expect. And to be honest, there are not a lot of Black men in the profession to begin with. And most of them are already busy mentoring like 500, 600 people. But there are a lot of good mentors out there, actually, and they come in all different packages. So again, it's about those isms, right? You have to make sure that you don't take those isms that other people have and put it up on yourself. You have to let them deal with their own isms, and you continue steadfast and go for the goal.
I'll share as well. So I'm the opposite of everyone on the table. All of my mentors have been Black women. It kind of just came about. I didn't necessarily at first seek it. My first mentor, who's still my mentor to this day, is Dr. Anita. And she was at Montclair State University, and she was actually an advisor for one of my friends, and I just sat in on a meeting, and she kind of adopted me as her advisee and definitely helped navigate this process. She's the one that kind of pushed me into even applying to NYU and applying to PhD programs and going straight through. And then now one of my mentors is Dr. Lanier, who's at the College of Nursing, and she's also my boss and my mentor, so that is interesting. But off of what Dr. Peprah was saying, she is someone that will not take anything other than the best from me. So she's one of the people, I can give her one of the best presentations that other professors have told me that this is great, but since she was the director of my internship, she would give me so many edits, like telling me that this can be better, that can be better. So that's been super helpful. And then she also pushed me to find, even if it wasn't a mentor, an advisor, someone that can help me outside of Black women, because she kind of noticed that all of the people that were writing my recommendation letters were women of color. So she kind of pushed me to push outside of my box, and I reached out to Dr. Jose Pagan, who is also one of the people that has been vouching for me during this PhD process. So, yeah.
So like some others have said, my three main mentors have been white women. I had Julie Carmelt at Cornell, I had Dr. Diana Silver here at NYU, and I had Melina Sullivan at my job at Avalere Health. And what drove me to them, or for me asking them to be their mentors, was that hearing them speak, and they were absolutely passionate about what they did. It was infectious, and I knew that I really wanted to learn more about them. Reached out, asked for coffee, asked to chat with them, and had asked them if they could, take me under their wing and kind of teach me what they knew. Similar to what the panelists have said, in every mentor relationship, I've worked under them either as a student or as a TA or as a consultant, and they have expected nothing but excellence from me, and they have no problem saying, I know you can do better than this, like go back and do it again. But I also know that they will fight for me in any situation, and I think that combination is what makes a great mentor, and it's important to see that in someone. I also think it's important to foster your relationship with your mentor. Even though I left NYU, I still stop by and see Diana Silver when I can. When I'm at Cornell, I still see my professors, and we email and we chat, because that truly can be a lifelong relationship. And you never know when you may need them or when they may need you. So that's always what I tell people, to foster that.
Thank you. And just to add to that, something I would like to highlight is the fact that, our panelists, they were not just like sitting around and waiting to be discovered, if I can put it that way. There is a part about actively seeking out who you would like to be a mentor, or who you would like to be part of your professional network. And I mean, it's okay to edit that list. I would say that it's okay to edit that list, but it definitely pays to be a proactive person about building that network for yourself. And to sort of expand on my question from my own personal experience, I do have mentors, but at the same time, I would also like to acknowledge certain people that were in my life at a particular season that sort of pushed me in this direction. And it's a whole range from I would say from my mother, my brother, and a friend pretty much put together my my decision to pursue an MPH. A friend was like, I wanted to go to med school. I was in the process of applying. I was waitlisted at some point. And while that decision was pending, she pretty much was like, oh, Timmy, I know you. So now she's known me since 2006, right? And this was probably 10 years after. And she's telling me, I know you, and I think you'll be better of a public health person. I was like, oh, okay. I took it and I explored it. And here I am today getting a PhD in public health. And and just to say that, like Dr. Goodman said, it would not always come in the package you expect it to come, but being open and flexible to explore when an opportunity is in front of you to see what you can get out of it, either through a relationship or a networking opportunity, or saying this is what I have to bring to the table, but I know it's not enough, and I would like some help to get better. There's also credence to that. And so to take this on, I would like to ask you what the field looks like in terms of diversity in public health. And we can talk about this diversity not just from race, ethnicity, but also what diversity looks like to you and if that's being represented in the public health space today. And what you hope it looks like 5 years from now, 10, 20.
So from a policy perspective, because that's the area where I work, in terms of thought, there is definitely a diverse group of people and diverse thoughts there. Unfortunately, in terms of race, I don't tend to see many people of color in health policy, which is really unfortunate because health policy is really where things start. You're really creating the foundation for a lot of things that are happening within our communities that really impacts all of us. So I work with stakeholders across the spectrum, drug manufacturers, payers, those are your health plans, patient groups, provider groups, advocacy groups, trade groups, anyone that is associated with the healthcare system I work with. And oftentimes I will go into these meetings with like board level 30 people, and I'm giving my presentation and I take a second and I sit down and I'm eating my lunch and I scan the room and I realize it is a room full of white men that are making decisions that impact all of us. And I take a step back and I say, I didn't realize that just until now. Well, you keep on going with the presentation, but then what do you do at that point? I do things like this, right? I kind of hope to educate people and say, policy may not be as glitz and glam, and yes, reading hundreds and hundreds of pages of legislation and regulatory text a day, some people may not like it, but it's an amazing field. You have so much gratification at the end of it. And I think more people should try to go into it as well. But what I hope to see in a couple of years, I hope to see health policy specifically more diverse. I think when we're making these rules and we're making these laws and we're engaging with stakeholders, I feel like it needs to be representative. And I don't think we're there quite yet. But I do think that there are people in this space that have diverse thoughts that are helping to push the narrative further. I just think it can be a little bit better if we had more representation in the room.
So I just recently co-authored a paper with our dean of our school about racial and ethnic diversity in academic public health. And it was basically a 20-year update to a paper that she had written in 1999. And so what we saw is that diversity is increasing, but it reminds me of the Devil Wears Prada, at a glacial pace. It's not increasing at the rate that I think most people would like for it to increase. And it's definitely not increasing at the top levels. So leadership and management, it's definitely much slower than junior levels. That being said, I do think public health is an attractive field for a diverse group of people, just because it sort of has a social justice focus, and I think students are attracted to it. And so I am optimistic because now there's lots of public health on the undergraduate level, which was not the case 20 years ago. And we know that undergraduates are more diverse than graduates. And so hopefully this opens up a pipeline where students are finding public health in undergrad and not on Google like I did, where they're sort of being introduced to the field much earlier. So I think we're optimistic about the future. I became a professor because I never had a Black professor, so I do think it takes some of us to change the field, and so, your turn.
So, in my experience, when I started graduate school, and I'm not going to say when, I would show up at conferences, and honestly, all the black people at the conference knew each other, and it was about 4 or 5 of us. So this continued for about, I don't know, maybe 3 or 4 years, and then after that, some new blood showed up. So and so as Melody has stated very aptly, that there does need to be an increase in diversity. I will say this: Black women are doing great in terms of diversity. Black men are not doing as well. So, even in the field of public health and several other fields, there's not a lot of black men there. And I think that I will say this: when it comes to diversity, there has to be a diversity of viewpoint. So just because a person has your same skin complexion does not necessarily mean that they share the experiences or understand some of the passions that you have. And as you encounter a lot of different professionals, you'll encounter this same issue. So I think that in terms of diversity, I am definitely a champion of diversity. And walking into a room full of, pardon my French, full of either white men or just certain individuals of one particular ethnic persuasion, I think doesn't really matter. The question is, are there just enough rich and diverse experiences that exist that you can have a very lively debate? I think it's important that there is representation, but I also think there is importance in terms of representation and diversity of thought also.
Can you repeat the question one more time? That's a lot listening to everyone.
So the question is really how you view, do you think there is a diverse representation of public health now, and what would you hope to see moving forward?
Okay. So as you guys know, I'm a recent graduate, so I do think that probably in comparison to like what Dr. Goodman was saying, I did learn about public health when I was an undergrad, and I have been exposed to a bit more of diversity. I think that because the communities that I intentionally work in are Black and Brown communities, so all of the public health experience that I have has been within communities of color. I don't always notice the lack of diversity, but when I got the opportunity to present at APHA in 2018, that's when I realized that, well, public health is not really occupied by enough Black people because it does have this strong social justice component to it. And many of the conferences that I've been to, I still don't see enough people of color. And I think that a way to change that is by having conversations like this and by educating other young professionals, Black professionals, of public health and the opportunities that you can experience within public health. To this day, a lot of people still don't know what public health is. And there's so many different avenues that you can explore. So even if you want to be an engineer or a nurse, there can be a public health component to it. So just sharing that and letting people that are younger than us into this space and educating them on the gratifications of this space.
And this brings us to another question, which is really, for you personally, how have you gone about catalyzing or effecting change? I would say particularly communities of color. Are there personal triggers to how you have gone ahead to effect change for the communities of color? Is that of particular interest to you, or did that just organically come into your space as a public health practitioner?
I'll start.
You could see it.
So I think that has always been there. So like I said, the reason that I became a public health person or practitioner or professional is because my sister was diagnosed with sickle cell since birth. And sickle cell is a disease that primarily affects Black people, especially in this country. So I've seen a lot of social injustice, I guess you can say, or health injustice during her sickle cell experiences. As far as she's a Black woman, they're less believed when it comes to pain, and I've seen that literally firsthand, especially now with the opioid epidemic, a lot of people think that, oh, let me backspace. So sickle cell is a disease that affects your red blood cells, and there is no real way as of now to determine how patients are experiencing pain or if they're in pain. And the way that they get medicated is through very strong opioids, so such as like Dilaudid. So what it looks like for a sickle cell patient is that they walk into an emergency room and they're in the middle of crisis, and they're basically telling the the doctor the amount of medicine that they normally get when they are able to go to the clinic. And for people that are experience crisis more, they have higher levels of pain, and they have higher levels of opioids that they need. So it's a Black person asking for pain medicine, and a lot of the times they're not believed. Or even when they are hospitalized, a lot of the times they're rushed out. There was an experience where my sister was about 7 months pregnant, and a doctor was trying to kind of push her out of the hospital because they don't want people to stay in the hospital too long. And she got discharged, and then as soon as she got home, the hospital ended up calling and saying that her I can't remember, one of her levels were extremely low to the point that she can pass out. And it doesn't make sense why this is happening, but because they wanted to push her out of the hospital, these things are happening. Did it have to do with her color? I don't know, but she is a woman of color. So I think that automatically pushed me into wanting to do advocacy within the public health space. So from then, when I first started, I worked with the March of Dimes, and I worked with Black women who were pregnant within Newark, New Jersey, and helping them to gain access to prenatal vitamins and Medicaid. And then now I did HIV prevention work within the South Bronx with young couples. And more recently, I started doing sickle cell research. So I think that from her experience, that kind of just automatically made me want to specifically focus on communities of color.
And do we have other viewpoints on this question?
Sure. So most of my research is based within Africa. So sickle cell is a focus of mine. So the evidence-based intervention for sickle cell disease in terms of hydroxyurea exists. In African populations, actually you have less than 1% in Nigeria, by far the most populous country. There are more babies born with sickle cell disease in Nigeria than in any other African country. Yet the prescription of hydroxyurea for the disease is less than 1%. So trying to think about how we scale up that intervention so that we can really start to address this disease and then improve the mortality rate for these children, because you're having a lot of children, over 40 or 50%, depending on what data you're looking at, die before the age of 5. Now, it's not only due to hydroxyurea, it's also due to pneumococcal infections and other things. So there are evidence-based interventions for that. Another thing that I'm working on in terms of my lab is looking at how we can really address obstetric hemorrhage via risk stratification. Obstetric hemorrhage mortality in women in Africa is significantly high because in many parts of Africa, a lot of women give birth at home. What we're trying to do is basically use a risk stratification technique that was actually developed in New York State by the American College of Obstetricians and Gynecologists, ACOG, to stratify women based on risk for obstetric hemorrhage so that we can advise those women not to give birth at home. Because unfortunately, if you are at an increased chance of having a hemorrhage and you give birth at home in Africa, there's possibly no way you're going to be able to make it to the hospital. Mm-hmm. And even if you do make it to the hospital, you have to make sure you go to a tertiary level care, a hospital, so that they have those particular facilities that can address that. So those are sort of the two, and there are other research that I'm also interested in, but those are sort of the two areas that I'm very interested in, that I think that there's a significant amount of evidence that we can improve mortality for both women and also children with sickle cell disease in Africa.
Any other viewpoint?
So the clients that I work with are oftentimes trying to create solutions, turning around access, quality, and cost of care for individuals of low income and individuals with chronic conditions. So they are coming up with very broad, high-level solutions to help those specific populations. And oftentimes when they come to our firm, we're kind of there to kind of push back or offer some adjustments or kind of assess what their idea is. So for me as a consultant, especially a consultant of color, I always look at it from the lens of, is your solution going to be accessible, right? What you're proposing. What is a person of color or is someone in a marginalized community going to be able to access what you need? Are you explaining it in the right way? Are you maybe going about it or making sure that you're educating people the right way or using the right resources? Bringing in that perspective to make sure that the solutions that they're doing, which are great, are accessible to our communities. And I think that's the type of perspective that I try to bring to any client that comes to me.
So I grew up on the south side of Jamaica, Queens, and I remember like policies and interventions being implemented on us. So I do a lot of community engaged research because I think it's important to work on the problems that the community thinks are important instead of problems that other people have decided should be important for them. And so I work a lot with African American and Hispanic communities, really working on, so I'm a statistician, so really there's always numbers behind anything. So really working on any problem that a community is really passionate about, but they feel like they can't get traction on. And they really want some interests being supported. And I do a lot of work about how segregation impacts health and how social factors impact health. So.
Thank you. And just to expand a little more on this question, we would see that in this conversation, the context really does matter. So it is great to theorize, right, about what a problem would be and what the potential solution could be of that problem. But it never the point is it's going out to dealing with real lives, real people, real situations, and also understanding that these problems are evolving, right? So there's also a sense of urgency, I would say, about what we deal with as public health professionals and budding professionals, and having always having it in mind that the context would have to matter in terms of how we propose solutions, or rather how we deal with solutions and or with problems and the kind of solutions we propose for those. And that has definitely reflected itself also in my field of research, which is all about context. And what I'm working on is looking at how to ensure that some of the evidence-based interventions that historically have been developed in higher income settings and tested here and shown to work, but are being replicated in lower income settings. And for me, my focus area being like the low and middle income countries, to see how to ensure that those interventions are feasible given the fact that empirically they were tested elsewhere, right? And we want to understand how does the context influence the feasibility of this kind of interventions. And so this sort of brings me now to some of the challenges that sort of stood out to you as you as you've developed your public health profession, some of the challenges, and as you talk about them, give us some words of advice as to how you navigated those challenges, tricks of the game, whatever you want to call it. And anyone can start.
So one challenge is always funding, so that is always a headache. So I don't know if there are any tricks other than you just have to keep trying. So that's a challenge, and maybe it's just because I have grant on the brain for today or something. That's definitely a challenge.
I think the challenge for me is I teach a subject that students inherently don't like. And so I feel like I have to do a lot of edutainment, where I have to like make it interesting, or make it relevant, and try to be fun, teaching things that I think, not that they don't want to learn, but students I think come in with like a biostat block. Like they've either already decided they can't do it, even if they've never tried it, or they've decided that they're not going to like it. And so I feel like I have to do a lot of convincing that it's fun and cool to be a nerd. So I think that's the biggest challenge I face, because it's just exhausting.
I think for me, as I'm starting out, sometimes it can be difficult to prospectively see success when I don't see people like me in those successful positions. So kind of figuring out like, what do I need to do to get there? First is the question of like, can I get there? And you knock that out of me. You're like, of course you can get there. But it's making sure that you are strategic about how to get there, making sure that you're communicating with people that are in that space. Maybe they don't look like you, but they have made it there, and having those conversations. Making sure that you are self-aware of what you need to get there and what you lack. So is there experience that you can do, or maybe some additional context that you could understand, or additional class, or a certain skill that can help you get there? Being very transparent with yourself and saying, where are my gaps and how can I fill them in to get there? But I think, once you get past that first stage of, even though there aren't people like me in this space, I can fill that space and lift as I climb, you will start to see progression towards where you want to go.
I think for me, one of the challenges, public health is very broad. So when I first got involved in, when I did my undergraduate degree in public health, I was like, I love public health, I love everything about it. And that was the problem, I loved everything. So trying to narrow down my focus, and then even coming into NYU, I started off as global health, and then ended up doing policy and management, still narrowing down and finding out what my actual interest is. And it took me actually like circling back and figuring out, why did I join health to begin with? And that's when I realized I did this because of my sister's sickle cell, and I'm passionate about being an advocate for sickle cell. So boom, I want to do sickle cell research. I don't currently do I don't currently do sickle cell research on a paid level, but for me, what I had to do was just reach out to people. So I recently reached out to a sickle cell researcher who's at Michigan, who's doing work over there and just doing sickle cell work, and literally just put myself out there and emailed her twice and made sure that I was on her radar, and now we're working on a manuscript together around her dissertation, which had to do with sickle cell patients in Brazil. So I think that finding out what you want to do within public health, and then literally putting yourself out there and reaching out to the people that are doing exactly what you want to do, and finding out how they got there, what are the tips that they can help you with, and how can you help them as well.
Thank you. So, most of this conversation has been between myself and our panelists, but I would like to give you an opportunity to also ask questions from the panelists, anything specific, broad, whatever it is. This is your time. So, do we have a mic?
Yeah.
So use this opportunity. They're here, but like in New York, it's very hard to get an appointment. Very important in successful people. So.
Hi, good evening. I know earlier in the conversation that you said to, when you go into these professional spaces, don't necessarily think of yourself as a Black professional, but a professional. But what I struggle with is when you go into a space and you encounter racism or another form of ism, how do you counteract that? Because I don't feel like I have the skill or the experience level to be like, well, I'm a great professional, so I don't care about your opinion. So like, how do you just like navigate those spaces to like, I guess, grow and not
like feel the pressure of falling within the view of whatever it is that these people place on them.
So hard work always pays off. If you are good at your job, not a whole lot else matters. You're gonna face racism everywhere. You can face it at the McDonald's, you can face it on the subway, you're gonna face it in your office if that's what exists. I do find that public health in general tends to be a more welcoming space. So it's not like some other fields, and that doesn't mean that we are perfect, but I do think we are better than a lot of other fields. For me, racism is other people's problem. It is not my problem. And I don't hold on to any of that stuff. Like when people put that stuff on me, I'm like, that is you, that is your stuff, and for you to talk to with your therapist. I talk to my therapist about a lot of my own issues. Racism is not one that I have to deal with. So you do have to learn how to navigate the system. You definitely need allies, and you definitely need sponsors. This is one of the reasons why I think having mentors that are different than you is important. Because I've had a lot of white male mentors, I make them address racism with their colleagues, which it comes off different when a white man is talking to another white man about how he treated someone than versus me trying to talk about it. So especially at a junior level, you just, it's above your pay grade. It's above me now, right? You send it up the ladder and you let other people handle it, and you do your work well. Because if you do your job well, I never thought I was going to be an associate dean, but I did my job well and someone else saw it for me, right? And so, if you're doing the work that you're supposed to do, if you're showing up, if you are on time, there's some things that it takes no talent to do. To show up on time, no talent, just a watch, right? To be present, like when you're in a situation with someone, to be present, right? And to do good work. You guys have every answer you want is out there. Like, we were creating wheels. You guys can just YouTube it and someone will actually show you how to do stuff, right? So, you're doing the things that you want to do. If you're passionate about something, that will exude from you, right? And if you're doing a good job, regardless of what people think about you personally, they will respect you professionally.
Speak into it.
Thank you. So just for me, my question is, being an international student and being from Africa and having a huge different culture and training and background, finding a mentor can be for me, it's more like find someone you can connect with and know, someone that can really get who you are and you're a person. Coming to America and then trying to establish that, sometimes you try to see this person has an African background or something, as this thing that I think is my culture or my style, and then you're trying to reach out to them, it's no response. And then there's this open mind as well, so who do I go to? How do I get this mentor in this new world, in this new path for me? So I don't know how, if anyone could answer it, because this is a different approach, someone moving or migrating from somewhere else to America, which is, I don't know, maybe other people actually have the same frustration, but coming here and being fresh and being new and trying to connect, and it's we don't know you, we don't want you. So what's the approach to do that?
So there's a saying that just because someone is your skin folk don't mean they're your kinfolk, right? Just because someone shares the same complexion as you doesn't mean that they have the same lived experiences that they're going to relate to you in that way. So it's about what I said earlier, all of your mentors are not going to be in the package that you expect them to be. I don't expect for my mentors to have had my life experiences, but I do expect for them to listen and understand and try to relate to the best of their ability. And really, sometimes it's important for someone to be different from you because they will ask you key questions. So I once went to one of my mentors and I said, well, this is racist. And he said, why? Why is it racist? And he made me really think through if it was racist. I was like, maybe it's sexist. Maybe it's, he really made me think through what I was saying, because I think another Black person would have been like, you're right, that's racist. They would have just let me live in that space. Right. Whereas because he wasn't being confrontational, he just really wanted me to explain to him what I was experiencing and what I was feeling. But having me articulate that made me even think about it a little bit differently. Right? So jerks come in all races, size, colors, and creeds. There is no quality for what a jerk is going to be. And you will encounter them in all aspects of your life. Right? And just because someone looks like you doesn't mean they're not a jerk. It doesn't mean that they're going to treat you well. Right? And the thing about finding mentors, for me, I had a Black mother who told me no all the time. So if no is the worst answer I'm going to get to a question, it's definitely worth asking the question, right? It's no, I eat those for dinner and I can move on, right? I'd rather someone tell me no, right, and be upfront with me, like, I don't want to be your mentor, than people who sort of like pretend to be your mentor, like appear to be helpful without actually helping. To me, that's worse. I'd rather someone just say like, you ain't my people, right, and move on. Right? And so sometimes you do have to get no's. The other thing I would say is that mentoring is not a job for one person. You should think of mentoring like you need a mentoring committee. It's sort of like a family, right? You can't, you need all of those people. It takes a village to raise someone. It's true professionally too. One person is not going to give you everything you need, right? And a lot of times what I tell my students when they come and ask me for advice, I give them my advice and I say, now go ask 3 other people the same question. You're going to get 3 different answers. And in the middle, there's the truth for you. And you need to weed through what people are saying, right? And so, I think you have to look outside the box of what you expect your mentor to be and open up to some people who you think like, oh, that person wouldn't want to mentor me. The white men that mentored me, I never thought that they would. But I've had people mentor me like, even after I quit a job with them, to still say she's a good person, you should hire her, you should work with her, she does good work, right? And so really, mentors are great, but who you really want are sponsors. People who are going to talk about you when you're not in the room, who are going to talk you up, who are going to put you into positions, right? I had people who basically made a job for me somewhere because they kept telling the same person, like, you want Melody, that's who you want, right? And so I think you have to be open-minded about mentors, right? Like Dr. Peprah said, the Black mentors, those that exist, there's few of us, and you guys can't say y'all don't have no Black people because, we didn't, but y'all do. But if someone who's mentoring 500 people can't give you the one-on-one that you're looking for or that you need, right? So go talk to the person that no one wants to talk to. You never know what gems of wisdom that person has. And the other thing I would say is I always talk to the person who I think is about to retire. Because they have so much life wisdom. They have so much job wisdom. And then there's just something about being a certain age where you just don't care anymore. And that's the kind of person that I want, that's just gonna speak their truth and not be like, is this politically correct? Or, they're like, I'm about to retire anyway, so I can just tell you what the truth is, right? And so I always seek those people out. And you'll find great advice from people that you may not expect it from. You will find that the white guy was on the lines with Dr. King, but you would never expect that because you have these preconceived notions and biases, right? And so you just never know what anyone's context is. And so just because people look like you can't expect that they're your people, right? And you have to expand what your people look like, because people that are for you, like really for you, can change your life.
Going off of what Dr. Goodman said, I would focus on the content and the substance of the person you're looking at, and not just what's on the surface. But I'd also add that not everyone's meant to be a mentor. I always tell people that I work with or people in other spaces, not everyone's meant to be a supervisor, not everyone's meant to be a mentor. Some people can be great people, but they just can't manage or they can't pass on what they know, and that's okay. But I think if you see that red flag of like someone isn't willing to engage, you move on and find someone else that will.
So just to piggyback on it, I think excellent point. I'm in your shoes. I was born in Ghana, came over here, did most of my schooling here, got a PhD here, and I have to support everything that they've said. In terms of mentorship, you have to look for mentors that are outside of your own prism in terms of who you think a mentor should be. As I've stated, one of my greatest mentors was my PhD advisor, short Indian lady. Another one in terms of a white woman from Emory University, and in fact, I'll be there this Saturday, so I'm sending her an email, see if we can have lunch. So all these people have really been an instrumental part of my life in terms of just helping think about things, deal with some issues in terms, and you're always going to have issues. that is life, right? But the question is, do you have the foundation? Do you have the team of individuals? So, as he also stated, you need a team of individuals. So every person, you just don't have one mentor, because again, you need different mentors for different situations. And it is also important to have an advocate. As you continue to progress in your professional career, it's always important to keep in contact with those mentors. And I think you said it just exactly right. If no is what you get, that's fine. Keep on going. All you need is one or two doors to open for an opportunity. Every job that I've had, it was just one opportunity opened up. I don't need to go and apply for 10 different jobs and get 10 different offers. I've always stated I only just need one offer, and then that's it. And that has worked out very, very well in my life. I never thought I would be at NYU, but I never was ever close to the opportunity either. And when the opportunity came, and I was thinking about, well, should I leave DC and come to New York? I said, why not? What is the risk here, other than just expanding myself, having new experiences, new opportunities, meeting great people like yourself, so and just being a very good school. So again, look outside of the normal individuals. There are actually a lot of people that are willing to mentor you. Actually, there's a white guy sitting in the back that also is a great teacher, and he's a great mentor. So everybody knows Jack Carolina. So I also consider him to be a mentor for me, because when I got here, Jack had tons of knowledge about NYU. And when you sit down with people, you understand the depth of knowledge that they have, and they're willing to talk to you. That is how you develop a mentoring relationship. And again, you need all different types of mentors. You just don't need one mentor. And those mentors become your advocates. And those are the people that will definitely talk you up when you're not in the room. Again, we all have connections. We know people that, we probably overlap that we don't even know that we have. But again, it's those particular networks. And you cannot be afraid to knock on people's doors. I've heard more no's than I can ever say, but at the end of the day, I had a belief in myself that, number one, I knew that my work was good enough. Of course, I had people that helped me along the way in terms of helping me become a better scientist, and I'm still needs improvement. I mean, I can write a great paper, I send it off to one of my friends, come back, red ink. So now, if I send off a paper and nothing comes back, I'm like, they didn't read it. So, that's the truth of the matter. I mean, it's the truth of the matter. Nobody's perfect. So if somebody has truly read your stuff, they're going to have a lot of comments, or at least some comments. So again, look for a lot of mentors. And again, you have to be at least confident in yourself. Understand the gaps in knowledge that you have. Understand where your weaknesses are. And we all have weaknesses. Even till this day, sitting up here, I have some weaknesses. Everybody sitting here, even the dean at our school has some weaknesses. She's probably more polished than all of us, but still, we all have weaknesses. And just because, you have a lot of white hair doesn't mean you're perfect. So again, I think that you have had a great experience having a lot of white management. I have not. I've had more women mentors, which is quite different too, but still, I think the quality of a mentor speaks for itself in terms of where we're ended up. So.
One thing that I wanted to add, I heard you say that sometimes they don't respond. So people are busy. One thing that one of my mentors taught me is that you send one email, that is not enough. The researcher that I'm working with right now, I sent her an email like 5 months ago, no response. I emailed her again, the same exact email, literally just resent it. And she responded back 2 months after that. And she was like, oh, this is great. I would love to work with you. I'm working on this. And the other part is doing your research. So sometimes the researcher that I'm working with on the sickle cell project, I've never met her face to face. It was literally a Google search. I looked up who was doing sickle cell. And then another person that I reached out to, Dr. Vince Bonham, who was at the NIH, literally Googled him, got his information. I think the first email, no response. Again, sent him another email. He got back to me, and he actually invited me to the National Sickle Cell Conference that I got to go there and meet other people that could be potential mentors or at least allies. So a no is not a no completely. And the other part about mentorship that I think mentees forget is that to ask our mentors what they need help with. So even though we're looking at them like, we need advice, we need you to help us with this, or how can you help guide me? You can ask them too, is there anything that I can help you with? How can I help you in this process? For me, on my end, as a researcher, I found that that's helped me. So I'll ask, oh, is there any manuscript that you would want help with? On my end, that's helping me because that's allowing me to get manuscripts under my belt, and that's helping the person who possibly had this great idea but just didn't have the legwork to be able to do it, to get it off the ground. So I think those two pieces, being persistent, reaching out outside of your network, even outside of NYU, and then asking mentors, what can you do for them?
Do we have time for more questions?
So I have two questions. My first one is, I have an undergraduate background in social sciences, so a lot of times people ask me, why are you doing public health? Because they see it as like mostly biological and medical. And so a lot of my ideas, especially when it comes to like certain ailments and disparities, I'm always looking at it from a social perspective or mental perspective or economic perspective. How do I bring these ideas into a space and confidently say how I feel about certain things, knowing that sometimes I get pushback because it's not seen or viewed as public health or as important to public health?
Public health is inherently disciplinary, and a lot of people focus on social science. Almost every school of public health has a social behavioral science department. And even most schools, even in the epidemiology department, they have a social epidemiology division. So I wouldn't be intimidated about doing social science. I do think sometimes, as minorities, some of the questions we ask, people will, I don't know how to say this nicely. People may look down on some of the questions that we ask, but any question is worthwhile. And just because someone else doesn't agree with it, that's exactly precisely the reason why you should keep pursuing it.
Yep, as Dr. Goodman said, public health is multidisciplinary. So in order for any solution to come to fruition, you need people from all different backgrounds and perspectives to come to the table to discuss how we're going to get this solution forward. And just like anyone else's perspective is important, so is yours. So I think coming in with that confidence and reiterating why it's important with the facts and your perspective, someone will listen. And if they're not, speak a little bit louder until someone does.
Just to add to that, the fact that you're coming in already thinking of the other disciplines outside of public health puts you at an advantage. I know that for me, I don't always think outside of the lens of public health, but I think it encompasses everything. Something that one of, I guess you can say, advisors told me, you need to think of, when you come at a public health idea, you need to think of the economics and the social aspect of it. So that actually puts you at an advantage and never stop asking those questions.
Oh, okay.
Dr. Goodman, when you said people coming with biostats with like a block, I'm one of those people. I felt a little attacked because I'm not a math biostats person at all. So I was wondering if I could possibly reach out to you like afterwards and meet. Would you be able to like link me with some resources or help with how I can better understand biostats because of that block?
I know someone who wrote a great book.
It's her book.
Questions? Okay, we have hours to.
Sorry. Hi, I'm from management track. I just need to ask that, as you said, sending not one email, sending more emails. I do that. But when I write in an email, I have a previous experience based on research rather than the consulting roles. So I don't hear back from them. I just need to ask that what should be content that needs to be written in the emails if you don't have much experience related to what you want to apply for.
this is a research opportunity or
No.
a work opportunity?
Like
Consulting?
consulting or management.
I think people in consulting spaces, like they usually have a niche and people love to talk about their niche. So if you can include something like that in an email, like I saw that you wrote this article and I thought it was really interesting and I thought about this perspective, what are your thoughts? And sometimes if they have some opportunities to respond, you can start the conversation that way. And that's when you could say, I'd love to talk more over coffee when you have a chance, and that's how you could start to gain that relationship. But I do hear you, like as someone said before, sometimes in consulting, like you get 1,000,001 emails coming from your clients, so sometimes emails that are not associated with work get put on the back burner. I would continue to be persistent and continue to try to find people that are in that kind of share that same interest as you. But I would kind of use that link if they're not responding to cold call emails, really try to look at their bio, look at their background, where they went to school, what they love to do, and start the conversation that way.
So I would say don't send form emails. So if you send me an email that I think you've sent to every other faculty member here, then I don't need to respond, someone else will. But the chances are that everyone has said that, and then you get no responses. The other thing I would say is that persistence is key. Everyone who has a PhD, it does not mean they're smart, it means they're persistent, right? And so we also look for persistence in the people that we are working with. So if you don't get a response, you should definitely write back. And then I would echo what Ekemini said, is that a compliment goes a long way. So if I open up your email and the first thing you tell me is I'm great, I'm gonna keep reading. And I agree with you, right? And so now we've found some common ground, and then I will keep going. So I think, you just do a combination of those things and you'll be okay.
Also introductory emails. I was the queen of LinkedIn, right? So I would go for first, second, third degree connections. So if someone from a company didn't respond, I would try to look for someone I went to school with that may know them or work at that company and ask them if they could introduce me. Oftentimes that would get me the response, and they'd be like, oh yeah, if this person's introducing you, of course we can get coffee, of course I'll respond or I'll jump on the phone with you. So I would go try that out too and really leverage the NYU community, because that is honestly how I got some of the opportunities that I did after grad school.
And we do have a NYU LinkedIn alumni page, I think. This was introduced to me probably 1.5 years ago, and everybody is now on my network. So you literally can search by NYU and have access to all those wonderful people that will connect you either on the first person level or to someone else that they know that can help with your questions. So we have time for 2 more questions. I know we had some in the past. And all right, you go first and then.
So right now I'm
You want to hold it closer?
Can I just speak?
Oh, okay.
Okay, so right now I'm a part-time consultant at the startup, and I'm going to be full-time there after I graduate. And one thing that I'm constantly having to, I kind of struggle with at work is kind of the ageism factor that you were talking about. Being very young, I'm probably the youngest person at the company, and kind of feeling bold enough to feeling bold enough to ask the questions or to maybe approach a case or something in a different way. Sometimes I feel kind of my opinion's not really welcome because there's this whole attitude of maybe I don't have enough experience, or what do you know as a senior in college. And I feel sometimes I leave client presentations kind of upset because I feel I could have contributed more, or I could have said something, or I felt I didn't really get the job done how I wanted. And so I guess as a professional that's moving up, how would you deal with situations like that, where you know what I mean, you don't want to step on people's toes clearly, but then again I don't want to be mute in the back of the room and allowing people to walk all over me just because they feel that I'm too young to know this much, and because they've had a 40-year career, they know better than me. And so I would love any tips, advice, something that I would feel I'm doing.
So they wouldn't hire you if they didn't value your perspective. So you have to start from a place of there, right? They wanted you to be there, so you have something to add. Depending on your situation, so when I was banking, one of the things that I would do is if I didn't feel like I could speak up, I would talk to someone more senior. So basically, you're just using them as a puppet. You would say like, Dr. Peprah, this is what I think we should say, and you let him say it. So you just have to figure out whether you should use your voice when you can, but sometimes your voice won't get heard. And so sometimes you just need to use someone else's voice. It's even true now, like sometimes I can send an email and sometimes someone more senior than me needs to send an email. It means I draft the email, they just send it from their email account, right? So sometimes you use your voice when it's good, but if you feel like your voice isn't heard, then use someone else's voice.
I think also going back to what Dr. Goodman said earlier, like people can't ignore hard work and dedication, and I think you said you're there part-time, and I think once you go full-time and you really start to develop and showcase the great work that you do, people will start to appreciate you even more. I've had opportunities where people say like you do great work, and then they see my resume, they're like, wait, you're only 25? And I said, yes, and they're like, you would have never guessed based on the work that you do. Let that speak for you, but also don't be afraid of your success. Like if you think you are great, if you think you have a great perspective, don't that kind of, I guess, falter your success. Like speak up, say what you need to do, that's your job, you're there to do that, and things will follow through. But I also agree with her as well with that.
And just to add to that, the way that you're feeling is perfectly normal. It's something that I think probably all of us can say that we've gone through. So it'll take practice and time. And once you start to develop your voice and start to speak up, you'll notice that in some cases people will actually value your opinion. And the more that you do it, the more you start to feel comfortable to do so.
Last question.
Hi. The topic of conferences came up a lot, and in terms of increasing diversity presence in public health, I would say conferences is a good opportunity to do so. However, I'm definitely one of the, not because I'm Black, but I actively avoid conferences just in terms of networking in a place that's like not, just it's harder because I don't have to talk to everyone that I don't know in the space that at work I have to talk to my bosses that become my mentors. So is there any tips of navigating spaces like that where you could be in a place that's a great opportunity to network and you would be there increasing diversity of public health, but you maybe don't know where to start in doing so?
So I think conferences are a great opportunity. So I think you said you're afraid of conferences. Did I hear that correctly?
Yeah.
Could you expand on that a little bit? So why are you, what is the fear? I think that will help you.
So I work in oncology data. So the conferences I would attend are either oncology focused or tech focused. And it's usually like panels like this and then open opportunities to network. However, I find that open opportunities are harder for me because I don't have the initial, like, it's easier for me to fire off an email and be like, oh, I know you from this or something like that. But just the initial aspect of networking in a conference, I think, is hard. And I find it even harder being the only Black person in the room. So any tips to navigate that would be really helpful.
I think first you should not internalize being the only Black person in the room. You're the only Black person in the room. That's fine. There's nothing wrong with that. I think for a conference, this is the strategies I use for conferences. I usually look and see who do I want to talk to. And then I usually have emails and send them and say, hey, if you're at this conference, let's have lunch. And that makes networking easier instead of sort of just having, meeting people. But then again, the great thing about conferences is those chance encounters with people that you don't know that might be familiar with your work and have great discussions and brainstorm over great projects. So I would say that conferences are a great opportunity for networking. If you have certain fears, I would encourage you, number one, to keep on attending, but at least make it a habit to at least reach out to individuals before the conference so that you can meet them at the conference and then talk about your work. Again, those opportunities are just, I feel like, golden opportunities because you get so many people. And then I would say expand your idea of conferences. There are several other conferences in the oncology field that you could attend. So there are a lot of conferences for so many different other things, and maybe some events that also overlap with oncology. So I would say just open your horizon and your perspective, and just don't be afraid to reach out to people and start a dialogue. Because again, I think you'll find it's more rewarding, you'll get more positive feedback than negative.
I was also in your position. At one point, I found conferences almost like overwhelming, and I found it helpful to, like, about a week before the conference, start preparing with, like, I guess, news developments that like pertain to the topic of the conference that I could speak to and like start a conversation with. So doing your homework on like who are the speakers, who will be at the conference, what are their backgrounds, what do they do, and making sure that you can like start or initiate a conversation based on some of those topics, and that can open the door to you speaking with these attendees. But I also think it's also sometimes practice. So like my mentors would they would flag that there's this conference and they say, come to my office, we're gonna practice like initiating conversations. Then you're gonna like practice how you're gonna walk up to me, or what are you gonna say, or how are you gonna start that conversation. So I think if that's something that you would like to practice, you can always reach out to your mentor and ask if they can help facilitate like engaging in something like that.
So I, like you, I feel more comfortable on email. So one of my favorite things to do at conferences is like, hi, my name is, I really would like to connect to you after the conference. Do you have a card? End of conversation. They give you the card, and then you could always follow up later just saying, I met you at this conference, da 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 da. So you don't always have to have like a long, awkward-ish conversation if you don't want to. You can just really say, I would love to connect with you at a different time. Do you have a card?
Or you could just, now people do it by LinkedIn. What I do at conferences, knowing that I don't have the capacity to like talk to 50,000 people, or however many, is just say, oh, so how do I find you on LinkedIn? And I add them right there and then, showing that I intentionally want to talk to you, not just like, oh, I'm just going through the rounds. So where do we have the mic? Do we have time for more questions?
For your answer.
Oh, okay. Sorry. So I was just saying use LinkedIn, because with cards, some people don't carry the cards around. Some people don't have cards anymore. So just add them on LinkedIn while you're there. It's like, I would like to connect with you after this conference. You have a LinkedIn account, and do it right there and then. Yeah. All right. So, well, we have come to the end of the panel. Do we have a little time for sort of networking afterwards? Yes. So if you have more pointed questions, you have access to our great panelists. And I would like to thank you all for taking time out to talk to us today. We really, really do appreciate your stories, your experiences, and advice as well. So thank you all for coming. A round of applause, please.